Hi, welcome to the Certificate in Holistic Dementia Care. My name is Max Watson. I work in the Northern Ireland Hospice where we produced the certificate. We created this certificate a few years ago because we realized there was a gap for those looking after patients who had end-of-life care issues and those who had dementia care issues. We were conscious within our own staff that while we were quite comfortable in hospice land of looking after patients with end-of-life care issues, we were not so confident in looking after people who had significant cognitive impairment. And that was the birth of the Holistic Dementia Certificate, to provide a certificate which would provide those who, in the course of their general duties, are looking after patients who have dementia, and provide those who, in their general duties, are looking after patients approaching the end of life, with a unified certificate which would give them the knowledge and the skills and the attitudes to be able to look after patients with both dementia and end-of-life care symptom issues with greater confidence. So that's the purpose of the certificate. What does it involve? Well, it involves an 8-week home study program. There's a handbook and there's a portfolio. We ask you to reflect on one patient with dementia and end-of-life care issues, what went well, what didn't go so well, and to go through the handbook, which we hope you will find really useful. There's been lots of positive feedback about that. And as well as that, there's the opportunity during the 8 weeks to participate in an online forum, which is moderated and supported. So you can get support from your peers as you go through the program. Within that area, there's also a whole host of online resources, which previous candidates have found really useful. At the end of it all, there's an assessment which involves a short exam, checking your knowledge in terms of using multiple choice questions, and also a component to check how you apply your new knowledge. And that involves looking at a video and making some assessments of how you would handle that particular situation in the real world. And the other evaluation component comes from marking the portfolio. And the three together, we hope, really encourage a good assessment of skills, knowledge and attitude. Those who have done the program so far have really benefited from it, we think. We know within our own hospice we've seen the amount of neuroleptic drugs like haloperidol being used to moderate difficult behaviours. That's fallen considerably since many of our nursing staff and medical staff went through the program. We hope that you might see this sort of effect as well. So thank you for considering doing the Holistic Certificate. If you want any more information about it, please have a look at our website or contact our certificate lead, Sue Foster, at the Northern Ireland Hospice. Thanks very much.